Good afternoon. My name is Lucinda Spencer. I'm a family nurse practitioner student with Maryville University in St. Louis, Missouri. Today I'm conducting a history and physical on MS. So MS, what brings you in today?
Getting my blood pressure checked.
So how long have you had high blood pressure?
About 5 years.
What do you do to treat that?
I take 2 pills, amlodipine and hydrochlorothiazide.
Okay. Have you had any problems with the medication? Any headaches, any lightheadedness, any trouble when you stand up and get dizzy, anything like that?
No.
Okay. When was the last time you had your medication adjusted?
6 months ago.
Okay, very good. About your past medical history, did you have any childhood illnesses?
I had chicken pox when I was younger.
Okay. Did you have any problems from that?
No.
Any measles, mumps, rubella, German measles, frequent ear infections?
No.
Okay. Have you had any other illnesses or medical problems since you've been an adult other than the hypertension?
No.
Okay. Any past surgeries?
I had my elbow worked on when I was in the 8th grade.
Okay. And what happened there?
I broke it.
Okay. Have you had any problems with that arm since then?
No.
Any weakness, numbness, tingling, anything like that?
No.
Okay. Have you had any other surgeries?
LASIK eye surgery.
Okay, and when was that?
About 11 years ago.
Have you had any problems with your eyes since then?
No.
Okay. Are you on any medications? You said you were on the amlodipine and hydrochlorothiazide for your blood pressure. Do you take any over-the-counter medications, any other prescribed medications, any herbal supplements, anything like that?
I take fish oil and daily vitamin.
Okay, very good. About your family's medical history, is there anything that stands out to you? Anything that runs in the family? Anything, cancer, heart disease, high blood pressure, diabetes, anything?
I had grandpa with kidney failure, grandpa and uncle with pacemaker, Alzheimer's, cancer, not sure which types, type 2 diabetes, and obesity.
So, who in your family had the cancer?
Grandpa and grandma.
On your mom's side or your dad's side?
Grandpa on my dad's side and grandpa and grandma on my mom's side.
Okay. And how about the pacemakers? Is that your mom or your dad's side?
Mom's side.
Okay. How about the type 2 diabetes?
Mom's side.
How about obesity?
Mom's side.
Okay. How about the Alzheimer's?
Mom's side.
And how old were your relatives when they were diagnosed with Alzheimer's?
In their late 50s.
Okay, very good. Any allergies to any medications, food, anything in the environment?
No.
Okay. Social history. Where were you born?
Vandalia, Illinois.
Okay. What is your current living situation?
I live with my wife and 2 kids.
Okay. Do you live in an apartment or?
We live in a home.
Okay. Do you live in town or in the country? In the country. All right. What is your highest level of education?
I went to community college.
All right. And what's your occupation?
Self-employed construction worker.
And how long have you done that?
15 years.
Okay. Are you sexually active?
Yes.
Okay. Any problems with that?
No.
Any chance that there could be any sexually transmitted infections?
No.
Do you have an exercise routine?
No, just work.
Okay. Any walking, biking, anything outside of work?
No.
Okay. And you work Monday through Friday?
Yes.
All right. I'm going to go through a review of systems and just kind of touch on everything and ask questions. And if I forget anything, please feel free to speak up and let me know if you have anything going on. Do you have any, just a general complaint, any weakness, trouble sleeping, any dizziness, any night sweats?
No.
Okay. About how tall are you?
5'10".
And about how much do you weigh?
197.
Okay, so that puts our BMI about 28. So it's a little bit higher than what we'd like to see. We might need to talk about some ways to help bring that down too. So we're just going to move through your system. So for your eyes, I know you have LASIK. Have you had to wear any corrective lenses since then?
No.
Have you had any problems with dry eyes, blurred vision, any redness, any discharge from your eyes?
No.
Any problems at all?
No.
Okay. So how about your ears? Do you have any trouble hearing, any ringing in your ears, any pain, any discharge?
No, I'm good.
Okay. Do you ever get, since you work outside, do you ever get wax build up in your ears and have problems with that?
Once in a while.
Okay. Do you feel like you can hear equally out of both ears?
Yes.
All right. On your mouth and throat, are you having any problems with toothache, sore throat, trouble swallowing, any sores in your mouth?
No.
Do you get a cancer screening at the dentist?
Yes.
Okay. When was the last time you saw the dentist?
A year ago.
All right. For your neck, have you noticed any enlarged glands or any lumps or bumps in your neck?
No.
Any trouble swallowing? Any sore throat?
Nope.
Any stiffness in your neck?
Nope.
Any trouble with movement? Are you able to move it in all directions without any problems?
Yes, fine.
Okay. Moving on down to your chest, are you having any difficulty breathing?
No.
Do you notice shortness of breath at any time?
No.
If you were to go up several flights of stairs or do something very physically demanding, would that get you short of breath?
No.
Okay. Have you had any cough?
No.
Any pain in your chest?
No.
Any nausea, nausea, sweating, dizziness, lightheadedness,
No.
Any kind of cardiac problems?
No.
Okay. Any problems with your abdomen? Any constipation, diarrhea,
No.
Abdominal pain?
No.
When was your last bowel movement?
This morning.
Okay. And how often do you have bowel movements?
3 times a day.
And that's normal for you?
Yes.
Have you noticed any changes in the color, consistency, or odor of your stool?
No.
Okay. Any problems with constipation or diarrhea?
No.
Any problems with your urinary system? Any prostate enlargement?
No.
Any trouble with urinating? Any burning when you urinate?
No.
Any trouble starting your urine stream?
No.
Do you feel like you're able to empty your bladder completely?
Yes.
Do you have trouble getting up at night to go to the bathroom? Okay. Any changes in the color or odor of your urine?
No.
Okay. Moving on to the peripheral vascular system, do you notice any swelling in any of your extremities? Like if you've been up on your feet for many hours, or
No.
Any pain in your extremities?
No.
Have you noticed any, if you have to walk quite a distance, do you notice any pain in your calves?
No.
Okay. The musculoskeletal system talks about the muscles and the bones. Are you having any problems with, have you had any other fractures besides the one in your elbow?
No.
Have you had any type of muscle weakness? Maybe where one extremity doesn't seem as strong as the other one?
No.
Any trouble with weakness at strange times? Any muscle cramps?
No.
Okay. The hematologic system discusses the blood. So have you had any problems with blood clots?
No.
Any problem if you have a cut, getting it to stop bleeding?
No.
Do you have any unusual bruising?
No.
Have you ever had a blood transfusion?
No.
Okay. The endocrine system, have you had any problems with your thyroid or your diabetes?
No.
Okay. Any problem with your skin, hair, nails? Any changes in the amount of hair on your arms or your legs?
No.
In your facial hair? You're able to grow your facial hair fairly equally. All right. Any thickening of your nails or yellowing? any rashes, spots on your skin that maybe have changed over time. Right. Your neurologic system. Have you had any problems walking straight?
No.
Any problems with dizziness or a feeling of unsteadiness?
No.
Any problems with memory?
No.
Okay. Um, on your mental history, any history of depression or anxiety?
No.
Any trouble sleeping at night?
No.
When you lay down at night, do you feel like you can't turn your brain off? You get this flight of ideas coming in. Do you ever feel like things are just hopeless or?
No.
Okay, very good. This concludes our review of systems for MS. Thank you very much.